evening, sir.
Good
Hello,
evening, sir.
everyone. Can we start?
Yeah, sure.
Okay. Hello, everyone. I'm Sanchika. I'm from ECHO. Welcome to the Sipher ECHO webinar on good and replicable and innovative practices of tobacco control in India. Today's topic is tobacco vendor licensing experiences across various states in the country. So our chief quiz for today's session is Dr. P.C. Gupta, who is the director of Healis, Sekhsaria Institute of Public Health, and our subject matter expert is Dr. Nidhi Sejpal Pouranik, madam, senior technical advisor and the union. Welcome to everyone. Now I would request Mr. Arun Verma, for the Director of Finance and Operations in Sipher, for the welcome address.
Yeah, good afternoon, everyone. I am Arun Verma from Team Sipher. A very well welcome to each one of you. Let me, on behalf of the organizers, extend our gratitude, heartfelt gratitude to our esteemed chief guest, Dr. Prakash and Gupta ji, who is a director, Healis, Sekhsaria Institute of Public Health, Bombay. Sir, we all know your commitment to the cause of the tobacco control. As we all know, Dr. Gupta is an international personality in this field of tobacco control. We are equally privileged to have with us Dr. Nidhi Sejpal, who is a senior consultant advisor at the union, who is a speaker for the day and will share with us her knowledge and experience on the tobacco vendor licensing across the country. You are welcome, ma'am. I also welcome Dr. Sonu Goyal, who is likely to join, probably has not joined us yet, who is a professor and he is a director of the E-Resource Center for Tobacco Control. I also welcome Dr. Rakesh Gupta, President Sipher, Dr. Rakesh Gupta ji, who is the president of the Cancer Foundation, Jaipur. I also welcome Mr. Rajiv Chaudhary, and I also welcome Dr. Dr. Sanchika Gupta. Yeah, she is with us. I also welcome Dr. Sanchika Gupta, who is a manager from the ECHO India, and all the participants as well as the public health students. Thank you so much, and once again, welcome to each and everyone. Over to Dr. Sanchika.
Thank you, sir. Now I would request Dr. Rakesh sir for discussion of the objective of the webinar.
Yeah, thank you, Dr. Sanchika. And the Resource Center for Tobacco Control, as everybody knows in tobacco control field, that it is under the Department of Community Medicine, School of Public Health, PJ Chandigarh. It organized a national conclave on best practices under National Tobacco Control Program in India, with an aim to compile various initiatives undertaken by the states and document it at the national and the subnational level with respect to manpower, empower, and NTCP for effective tobacco and nicotine control. The presentations by experts will help to increase the awareness and facilitate cross-learning among stakeholders for strengthening of the NTCP in the country and sensitize the stakeholders on best practices for its replication in other states. Today's topic and the speaker are tobacco vendors licensing experience across various states of India. So Dr. Nidhi Sejpal is already with us. She's a former technical consultant at the Ministry of Health and Family Welfare, and now she's a senior technical advisor in the Union Southeast Asia. Next, please.
Thank you, sir. Now I would request sir to introduce our chief guest for the day.
So I welcome Dr. Prakash Gupta, who is director of Healis, Sekhsaria Institute of Public Health, Navi, Mumbai, and he was to go to US today, and we are thankful to him for accepting our invite to be our chief guest. He's a doctor of science in epidemiology, Johns Hopkins University, and alumnus of Harvard School of Public Health, president of the 14th World Conference on Tobacco or Health. It was held in 2009, and also of the first 4 national conferences on tobacco or health, all in Mumbai. He received a Luther Terry Award of the American Cancer Society in 2003 and World No Tobacco Day award from Director General WHO in 1999. He has published several hundred research papers in peer-reviewed journals and edited or contributed to scores of scientific reports. He has held top position in India in public health and in dentistry in the top 2% list of scientists by Stanford University. So, sir, I'll request you to please give your opening remarks regarding the presentation. Thank you.
Thank you very much, Rakesh. And would like to congratulate and thank Sipher for organizing a webinar on this particular topic, which is extremely important for tobacco control in India and also very topical. Because as we know that an advisory has already gone out from the Ministry of Health and Family Welfare to all states to implement this tobacco vendor licensing, and some states have already done it. And I'm sure in the presentation that will follow, Dr. Nidhi would tell you all about that in great detail. But why do I think it is such an important topic for tobacco control in India? It is important from many, many points of view. You know, we have very good law COTPA on tobacco control. It has some weaknesses and some lacunae, and one of that is it allows advertising on point of sale. Now, this particular lacunae has been used by the industry to the fullest extent, with the result that in every survey that we do and we see the result, majority, not, you know, a very high proportion of our respondents say that they see tobacco advertisement quite often. And that is obviously because of this advertisements at point of sale. And not only that, the industry, now that it has realized that it can advertise on point of sale, it is actively working to increase the points of sale. It goes to, we have research results now to show that it goes to the points of sale which do not sell tobacco, like Kirana shop don't sell cigarettes, but they go, they request them to keep some cartons of cigarettes and put the board and of course pay on whatever compensation they want, and they agree. So we have photographs of the streets, full streets that are full of one after the other advertisements of these tobacco products. They should not be there, but just enjoy, just using the loophole and circumventing the law, they are there. And in the process, we also have found that the density of tobacco vendor has become very, very high in many jurisdictions. And we also know that a high density, high density of tobacco vendors leads to high prevalence of tobacco use. But I think the most important part is also protecting children. One of the part of our law, one part of our COTPA law is not to have point of sale within 100 yards of schools or any educational institution. But we also know that this gets violated quite often because the shops have been there for a long time and very difficult to uproot them. So only with such a move as tobacco vendor licensing, it would be possible not to provide license to shop to be placed near schools, or if they are there, then to take away their license. Also, we all see that these shops, kiosks especially, they have these tobacco pan masala kind of products placed next to candies and chocolates and cookies that children love and children like. So there is so much association that, like those products, these are also harmful products worth consuming, and that has a huge effect on children. But with tobacco vendor licensing, this can be presented. Also, we know that CODPA has a provision of a display of a board, no sale to tobacco to minors. And it's a very effective board because it has a photograph of oral cancer patient on it. But when we walk around the streets and see these tobacco kiosks, we hardly see that sign displayed correctly. And we know that that sign should be effective in educating not only tobacco consumers, but all the passerbys. So if there is a tobacco vendor licensing, then I think that particular provision would also be implemented quite strongly. So for all these reasons, I think that this is an extremely important topic, and I very much look forward to hearing Nidhi on her deliberations and her observations on the on how this this particular item is progressing in India. And I think it will be interesting and very useful for all of us to know that. So I give back to the organizers for further.
So thanks a lot, sir, for very briefly introducing the topic of tobacco vendors licensing and why it is so important to have tobacco vendors licensing. As we all know, it is part of the tobacco endgame policy for us also, and for a world over. I think this TVL is being used to promote this policy. So I think now we should listen to Dr. Nidhi. So over to Dr. Sanchika.
Thanks, sir. Now, with request, I would like to introduce Dr. Nidhi, who's the speaker for today. Dr. Nidhi is the Senior Technical Advisor of Tobacco Control for Global Implementation Program in India. She works in close coordination with the government, NGOs, local partner and civil society organizations to advance tobacco control initiatives at national and subnational level. Currently, she is working as a Senior Technical Advisor at the union. Over to you, ma'am.
Thank you so much, Dr. Sanchika. Respected Dr. Prakash Gupta, sir, my heartfelt pranam to you, sir, and thank you very much for gracing us in this webinar and chairing the session and giving me an opportunity to share few thoughts about tobacco vendor licensing in front of you, sir. My real heartfelt thanks and pranam. Also, my heartfelt respects and regards to Dr. Rakesh Gupta, sir, from Sipher, Dr. Rakesh Gupta, sir, from Jaipur, Dr. Arun Verma, the entire team of Sipher, Dr. Sonu Goyal, who I'm sure would be joining us shortly from PGI, and all the colleagues and participants. Namaskar, and thank you once again for giving me this opportunity. So I think Dr. Gupta, sir, has very rightly highlighted that why policies like tobacco vendor licensing are very critical in today's time, and how they play a critical role in sort of advancing the existing tobacco control measures in the country, how they can complement or the existing steps that are put in place by the government. So that is what we'll understand from today's presentation. Moving forward, is the screen moving forward? Dr. Sanchika, could you?
Yes, yes.
Dr. Sanchika, could you confirm if the presentation is visible?
No, ma'am, it was visible, yes, sometime back, but now you need to reshare it again.
Okay. Sorry about the technical glitch. I think I'll just once again reshare it. Is it visible now?
Yeah. Please do your slides on slideshow mode.
Better?
On slideshow mode.
It's on slideshow mode. Is it now working?
Yes, yes. Now it's okay. Please wait.
Okay. So talking about the tobacco control burden in India, we all are very much aware that about 267 million tobacco users, that is 26 crore to 27 crore Indians that are above the age of 15 years are using some form of tobacco. And we all also know that 21% of the adults use smokeless form of tobacco, which is the Kenny, Gutka, Zarda, all those kind of tobacco products. And 10% of the people use smoking tobacco. If we also look at the latest global youth tobacco survey that happened in 2019, I'm sure that everyone is much aware that we have about 8.5% users of children who are using tobacco in some or the other form, with higher percentage of boys, about 9.6%, while females having 7.4% who are currently tobacco users in some or the other form. And it's very saddening to understand and learn that these days the proportion of the female children that are lured towards trying these kind of products or trying these kind of habits is increasing day by day. And that is why the spaces like retailer environments become an important space for the industry as well as for the government if they want to regulate these kind of practices. As Dr. Gupta sir was also mentioning, the industry very easily plays these tactics where they try and advertise and promote their products most readily, given that they place these tobacco advertisements in close conjunction with chocolates, chips, candies. Also, as you can see in the picture, right where there are food products, just above that you can see there are tobacco promotion and advertisements, different kinds of advertisements that are put up. So it's very easy for these children to get attracted to these kind of practices, and which sort of pushes them for trying these kind of products. But as Dr. Gupta was also mentioning, there are a lot of global evidences, there are a lot of studies that are currently happening and which show that measures, innovative policy strategies like tobacco vendor licensing, tobacco-free generation, increasing the legal age of children come very much into play, come in handy for complementing and strengthening the other tobacco control measures that are already in place in the country. So why do we need to focus on tobacco vendor licensing? I'm sure everybody would agree with me that there are numerous unregulated point of sales across the country. There is not, you name the city and you can see every third shop or every fourth shop has tobacco products easily available, readily available to the children. And they are placed in such a manner that even if you go to buy cold drinks such as Coke or buy a packet of Lay's or Kurkure, these days children usually tend to do that, the cigarette products are placed right there. And the way the smokeless tobacco products are put up in front, it is so attractive that anybody would like to try these kind of things. So the basic idea is we want to restrict this kind of availability and accessibility of tobacco products, basically to regulate these kind of point of sales. Secondly, if you realize, vendor licensing is a policy measure that helps in reducing the density, as sir was mentioning, because you usually see that in a certain area or certain socio-economic locations, especially if you see in the lower socio-economic stations, the shops are placed so close by. Ek dukan nahi milega to do kadam chhod ke you'll see there's a second shop that's having that. Every store, be it a grocery store, milk booth, be it a cycle puncture store, be it a
Dr.
stationery.
Nidhi, I think the slides are not moving.
So it is it now?
No. There's some technical error. Or you can send it to Dr. Sanchika. She can share the slides.
Sure, sir.
Or you can send it to me. I'll forward it to Dr. Sanchika.
Sir, is it visible now?
Yeah, it is visible.
Yes.
Is it moving?
Yeah, it is moving now. Yeah.
Yeah, it's
now
okay,
it is.
ma'am. It's okay.
Yeah, it is.
Okay.
Yeah.
Okay.
Okay.
So as I was saying, as Dr. Gupta also highlighted, TVL is a measure that helps in reducing the density of the tobacco vendors, especially in certain areas that are frequented by youths, especially socio-economic status, lower socio-economic status areas where these kind of shops give out easy availability of these kind of products. Secondly, it also helps in ensuring that the local enforcement takes place well, and it helps in introducing more meaningful penalties. I'm sure everyone would agree, and that is the reason that the COTPA amendment bill is also under consideration. The fees that are already there, or the penalty fines that are there in various sections of COTPA, are not as impactful as they should be. That is why we are trying to work on increasing the amount of fines that are there in place. So given that these lacunae are available, strategies and measures like tobacco vendor licensing can really help in taking this forward. So what exactly do I mean by tobacco vendor licensing? It simply means that any vendor who intends to sell any kinds of tobacco products within the limits of a city or within a specific jurisdiction requires to take a license from the respective municipal corporation, and he needs to abide by all the terms and conditions that are put in place by the respective municipal corporation. Now, broadly, if you would see, there are many benefits of having this policy being implemented. The way I see it is they can be divided into three subheadings. The first and foremost, as I have been mentioning, it is to reduce the accessibility and the availability of tobacco products to youth. Second, it helps in complying or strengthening the existing tobacco control laws broadly. Thirdly, it also helps in creating a revenue generation model, which can help in generating revenue that can be utilized by the administrative authorities, focusing on other priorities at hand. So, talking about the first one, as you can see, how it can help us in reducing the accessibility and the availability. Firstly, if we have licensing procedure introduced for all the vendors who want to sell tobacco, it can help us in bringing down or decreasing the number of vendors. Why? Because not all all vendors will not be eligible to get the specific license. Only if they comply with the eligibility criteria, if they abide by all the terms and conditions that are chalked out by the corporation, they will be issued license. So hence, it will help us in reducing or bringing down the number of the vendors in a particular jurisdiction. Secondly, it will help us in reducing the density of these vendors. How? We can place restrictions on where these tobacco vendors can or cannot sell tobacco products. For example, it will help us in ensuring that no vendors are placed within 100 yards of educational institutions. It should be ensured that any hospital premises, any religious places, or specific markets, which are the common spaces and areas where these products are available, we do not allow vendors to sell tobacco products within these areas. Secondly, it will also help us in reducing the banning in specific locations, like I just mentioned about the 100 yards within educational institutions. Also, restrictions can be placed that there will be no sale of tobacco products within the areas that are frequented by the youths. For example, parks, playgrounds, amusement parks, or any such garden areas that are the areas where usually youth are found frequenting due to leisure activities. So these areas and pockets should be targeted, and if we focus on these areas, we can certainly bring down the number of vendors, we can cap on the licenses that are issued every year, and we can thus help in reducing the density. The second benefit of having this policy measure is that it can help in complementing various tobacco control laws. As you can see, it will not just help in further strengthening the various sections of COTPA, but it will also help us in ensuring that the Juvenile Justice Act is being abided by the vendors who are selling tobacco products. We can put in place terms and conditions that any vendor who sells tobacco product will not be selling any loose cigarettes. So we can help them comply with the ban on sale of loose sticks or single sticks in these vends. Thirdly, it will help in reducing the illicit trade or counterfeit products that are into the market circulation. Why? Because just the way any corporation today, you ask whether they have a data or do they have mapping of all the liquor shops within the city limits, pat, you will get the answer. They have the list, they have the areas where these shops are located. But similarly, if you ask the same question, how many tobacco shops are there within the city, where are they located, you won't get any reply. And that is because we do not have current census of how many shops are selling tobacco, where exactly they are placed, and what different kinds of businesses or shops are selling this tobacco. So through the mechanism of vendor licensing, this can be, sort of answered and addressed. So the government can exactly have the detail and the records of the vendors who are selling tobacco products. And through these shops, licensed shops, it can be ensured that only excise stamp duty or the products that are legal are being stored and are being sold through these shops and channels. So this way, the counterfeit, products that are into the market circulation can also be brought down. To commonly in the tobacco control language, what we refer is the track and trace mechanism. The government can ensure what kinds of products are being there into the market circulation. And last but not the least, we have seen that the Electronic Cigarette Act is also put in place since 2019, but we haven't really been able to enforce it to the level that we expect till date. So through the mechanism of licensing, even this can be sort of brought more into enforcement and more into existence. So this is how, through the measure of vendor licensing, several steps or several measures of tobacco control can be strengthened. The third and the most important mechanism is a self-financing generating mechanism. Through the application of the licenses, there will be a revenue which will be generated. Secondly, the fines, if the vendors are found to be selling tobacco products without having an appropriate license, as per the respective municipal corporation acts, for example, I'll give you about Ranchi. They have a provision that if any vendor is found to be doing any trade without the license or the permission of the corporation, they can fine them up to 25,000 rupees. So you can imagine, if one shop or one violation can generate so much money, if we strictly enforce tobacco vendor licensing, it can generate great revenue, which can help the corporation as well as the other administrative authorities for utilizing this money in the enforcement purposes as well as in other public health priority areas. So just to give you a glance of where these currently policy measures are being implemented. So as you saw in my title, I would be talking from global level to the local level. As many countries across the world that are currently implementing the concept of vendor licensing. As you can see, there are many countries in the Western world, but also countries that are very neighboring to India. I would like to share that as of today, if we see, there are about 22 countries across the world that are currently implementing tobacco vendor licensing. And out of these, not all are mentioned on the screen, but there are about 17 countries that have implemented this as a national policy, while 5 of the countries have implemented it as a subnational policy. So whether it's at the national or the subnational, but countries have been successful and have shown some evidences that this is a successful strategy, and this can help strengthen the components of tobacco control in the country. And you'd be surprised, our neighboring countries such as Bangladesh, Pakistan, Singapore, Vietnam, many of the Asian countries are implementing it. Forget the Western world. We know that the Western world have always been one step ahead of us in implementing such measures, but also the neighboring countries have done it. Then why can't India? So just talking about the evidences, as you can see, I'd like to share the first evidence from the city of Philadelphia. The city of Philadelphia introduced the concept of vendor licensing in 2016. They passed a regulation and they ensured that the density should be restricted only to one vendor per 1,000 daytime residents, not even nighttime, just daytime residents. That would be restricted only to one vendor. And this was implemented across all the 8 planning districts of the city. Secondly, they introduced that any of the tobacco permits that were new should not be placed within 500 feet of a school. So something similar to the 100 yards of educational institution. Usually in abroad countries, they consider USA, Canada, they usually consider as 500 feet or 1000 feet. So they ensured that none of the new permits were given that were falling within the 500 feet yard of the educational institutions. I'm happy to share that post intervention in 2019, when the study was done by Dr. Kaufman and his team, they found that due to the implementation of this particular policy, the tobacco retailer density had declined by 20% in the city areas, and this was found to be reduced by 22%. So almost it affected or it benefited about 84,000 students across 200 schools in the particular city. So you see, this is a strong evidence that these kind of strategies definitely turn positive when implemented in the right way. Second study that I would like to highlight here is that from Pakistan. In Pakistan, they utilized the lens of vendor licensing from a different perspective. They wanted to ensure that there is more awareness amongst the vendors and more vendors are licensed. So they introduced this policy, and then afterwards they did an evaluation study to see the impact, whether this has benefited the country or not. So they randomly sort of surveyed 175 tobacco vendors, and they found that more than 50% of the vendors had accepted the licensing policy and had taken the license from the corporation. The study also found that the licensed vendors were much more likely to reduce the sale of single sticks that were happening. So the vendors that were not licensed tend to sell more cigarettes, but the ones that were licensed, because they were well sensitized, they were aware that this should not happen. So there was a reduction in the loose sale of cigarettes that was seen amongst the licensed vendors. And third, and the most important component, was that they were able to see that this policy measure was able to garner about 20,000 US dollars in the fiscal year of 2017, which was utilized for the benefit of public health perspectives. So you see, this is also a method where tobacco vendor licensing can play a critical role. The third example I would like to share from that of Hungary. Hungary introduced this legislation in 2013, and through the vendor density model, they were able to bring down about 42,000 tobacco retailers across the entire country, 6 times down the original number, just to a mere 7,000 vendors in the country, and all of them were government licensed outlets. So my point here is, when we can have evidences from global, why couldn't we have the replication in India? And the answer to that is, we have provision, we have mechanisms, and we have programs being implemented in India as well. So just to bring to your attention, the concept of tobacco vendor licensing isn't any new. It is already existing in our constitution, and it is there in our constitution way before the time of independence. As you can see on your screen, there is an act, Punjab Tobacco Wins Peace Act. I'm sure Dr. Gupta sir would be very much aware about this, since its origin is always been in Punjab. Before even the independence in 1934 itself, there was this Punjab Wins Peace Act that had a provision that mentioned that any of the tobacco vendors or merchants who wish to sell tobacco products within that jurisdiction should apply for a license from the authorities. And as you can see on your screen, the different state governments had the licensing fee of mere 3 rupees or 4 rupees at that point in time. So it is not a concept that has come overnight or has just abruptly erupted. It is a concept which is there in our constitution. It is a concept which is already lying in the municipal corporation acts in various states. We just need to cull them out. We just need to revive them and make them rightfully implemented. So taking cue from this, there was a national and central advisory, as Dr. Gupta was mentioning in his opening remarks. There was advisory which was sent out to all the states across India in 2017, which encouraged the municipal just general knowledge among the public has increased quite a much. Also, we see a difference in the taps. So this is just to give you a sense of it. Talking about the other experiences across Uttarakhand and Karnataka. So we are currently also implementing the tobacco vendor licensing policy in Haldwani city and Devangere city, which specifically from the municipal perspective didn't have the respective structure. So we institutionalized a mechanism where the deputy municipal commissioner was appointed as the nodal to look into the operations. We specifically helped the municipal corporation to notify the squads that would be looking into the enforcement. Plus, we issued an implementation order to ensure that all sections of COTPA are complied by. We also help the jurisdiction to form and develop the operational guidelines, which is currently being adopted and soon will be implemented in both of the jurisdictions. Looking at the example from the state of Uttar Pradesh, as you can see in Uttar Pradesh also, Mathura Municipal Corporation has been the leading corporation where they are wanting to implement vendor licensing. And as you can see, a survey was conducted and it was found that about 2,193 total vendors were existing that were selling tobacco products, out of which they received about 218 applications, out of which 85 of them were approved, while 84 of them were rejected due to the eligibility criteria. And currently 88 licenses are under consideration. So these were some of the examples across the state. I'm also happy to share that many other jurisdictions, be it from the state level to the municipal level to the district level, have notified and are wanting to implement vendor licensing policy. And one of them having the highest legal regulation in place is the state of Himachal Pradesh, that has an act in place, that is the Himachal Pradesh Prohibition of Sale of Loose Cigarettes, BDs and Regulation of Retail Businesses of Cigarette and Other Tobacco Products Act 2016. But the implementation is still underway and we are expecting to see some positive results in the coming time. Talking about the states, I'm happy to share that across India, we have almost 8 states that have notified TVL from the state level orders, and we have more than 95 jurisdictions till date, ranging from the municipal level orders to the district level orders that have notified TVL in some or the other form. Just briefly, summing up the elements or the components that become critical for a jurisdiction wanting to implement vendor licensing. Few things that need to be kept in mind is, firstly, this particular policy measure should be population based. As I said, Philadelphia, if you remember, they introduced of 1 retailer per 1,000 daytime residents. Similarly, based on the best international practices, it is recommended, especially in the Asian countries, that this should be done at 1 retailer per 1 lakh population or per 10,000 population, depending upon the population of that respective jurisdiction. Secondly, it should be noted that the license fee should be at par, at similar to that as the L1 license of the alcohol policy. Third, they should comply with all the central laws and the state local laws that are put in place, such as the excise, the food and safety standards, so on and so forth. Also, it should be ensured that these tobacco shops should comply with all the regulations that are put in place for the liquor licenses. The most important thing is, again, to highlight here that just the way you have exclusivity for alcohol licenses, tobacco shops also should have an exclusive license, ensuring that these tobacco products are not sold alongside any chocolate chips or any such items that can easily lure children. And last and the least is that the license should be displayed in a proper conspicuous place which is easily visible to the enforcing authorities. So we've spoken about what is vendor licensing, how it can be implemented, and how impactful it is. So this is my last slide. Basically, I want to highlight that just like the other tobacco control measures, vendor licensing is also a multi-pronged approach. It requires the efforts of various key players in the city, not just the municipal corporation, not just the district administration or the district tobacco control cell, but the police administration, women and child development department, urban health development, panchayati raj development, education department. We have the tobacco free education institution component being implemented. Clubbing that together, tobacco free generation together, all joining hands together is something which can help us in taking forward the better implementation and enforcement of this particular policy. So with this, I end my presentation here and would just like to conclude that tobacco vendor licensing is a potential tool that can certainly help in reducing the number, location, and density of the tobacco retailers within a particular jurisdiction. Secondly, it can help in strengthening the existing laws and especially help in protecting the youth by reducing the accessibility and availability of these harmful products. With this, I end my presentation here and would be happy to answer any questions, thoughts, or comments. Thank you very much for having a patient listening. Thank you. And back to the presenters.
Thank you, ma'am, for excellent presentation. Now over to Dr. Rakesh, sir, for his comments.
No, Dr. Nidhi, I must compliment you for an excellent presentation. I think this has been one of the best presentations so far since when we started this series of webinars. And Dr. Rakesh Gupta is with us. He'll also agree with me. I think the slide with the benefits of tobacco vendors licensing, that can be put in the last as a carry-on message, actually. So what we need to do, number of vendors need to be decreased, density of vendors need to be decreased, ban of sale in specific venues. So I think that slide was excellent. So you can always put it in the last. And it is very encouraging to see that 95 jurisdictions in India, they are already following this tobacco vendors licensing. I may just tell you that when I was a state nodal officer in Punjab, so I came to know about this Punjab State Tobacco Vendors Fee Act. So it actually came in 1934, but it was repealed actually in 1953 or 54. I don't remember that. We tried to actually activate it. And we had we have completed the drafting of the act, but somehow we couldn't actually finalize it. And in fact, Himachal Pradesh, they just took over that act and they actually did it. So it is good that Himachal, they had a very proactive Minister of Health, Mr. Kaul. So he actually his efforts that this is in place now. So thanks a lot. So over to, I think, concluding remarks from Dr. Rakesh Gupta and then concluding remarks from Dr. P.C. Gupta.
Thank you, Dr. Rakesh Gupta, and Nidhi compliments. Every time there is some new point that many new points with every presentation that I find. It's refining. And as Dr. Rakesh says, the now 95 constituencies have tobacco vendor licensing in place. I wish to just confirm on that. Your presentation did not mention it in a way.
Yes, sir. It did have, I can share, sir, with you all the 95 jurisdictions. I have the compiled list with me, sir.
Yeah. So I think now the evidence is becoming more stronger and of constituencies or where the TVL is existing. How personal experience in Rajasthan working with SRKPS, I have found it that it's a very tedious process going through the municipal corporations. And I'm sure you must also be having this thought in your mind as to how we can simplify it or maybe do it in a way where we have a wider application through sort of one act or two acts in the state, or it can become a state level activity. So I do know that, yes, if a municipal act is amended, it can be then implemented in the entire state. But are there any strategies? What are the initiatives at the level of the ministry? That is what I would like to know.
Thank you for that, sir. I think, as you rightly pointed out, many of these states already have this provision within their municipal corporation acts. So it's much easier for them to sort of incorporate this, because we are not creating any parallel systems. We are utilizing their trade itself. About bringing it from the top level. So the state urban development department is the right department that has this power to sort of implement this, and this is what we are trying to do even in Ranchi. So we have approached the SUDA department there, and the urban development department is currently going through the operational guidelines that has been developed on their request. So we have shared that with them. They're just trying to accommodate and make arrangements for the street vendors. That is where the livelihood issue and the pushback is sort of taken care, and a smooth implementation across the state can be taken into consideration. So the best way to do is to involve the urban development authorities in the state level, have a SOP that can work as a guiding document, and sort of then pass it on along all the USBs as a mandate. So we are trying to do this, and once, based on Ranchi's experience, on Jharkhand's experience, we'll be able to sort of come out with more findings and more strategies, and also help replicate the other states.
So thank you, Dr. Nidhi. I think be in a hurry. So I'll just request Dr. P.C. Gupta to give his concluding remarks.
Thank you, Rakesh. Yes, I was about to leave. I have to go, but it was a great lecture, great presentation. And as Rakesh also pointed out, many items of information, new information that we didn't know about the extent of the already implementation and notification of these laws in India, in various jurisdictions, and in our neighboring countries also. So that's a great inducement, it's a great encouragement for all of us to go further and get this policy advanced and implemented. So thank you all very much. Wonderful presentation.
Thanks a lot, sir.
Thanks
a lot.
Thank you, sir.
So since we have some time, we can just give 1 minute each to Dr. Ramprasad in the same order. So Dr. Ramprasad, please.
Yeah, thank you so much. It was really a very nice presentation. I really learned quite a few things which we are not exposed to, or which we were not aware of. But at the district level, when we are actually approaching the relevant officials and the support organizations, the support that we receive is directly proportional to the information and awareness which they have. So until and unless there is a proper mechanism of percolating and disseminating the information at all the government sub-related bodies and organizations, the cooperation from their side will be a little restricted, slow, and reduced. So just wanted to take your inputs and just my thoughts on that. Yeah, thank you so much. Thanks.
Thank you very much, sir, for highlighting that point. And I very much agree that it makes it much more easier if it is coming from the top level. But sometimes so not all jurisdictions are same in that matter. From my personal experience and the implementation across the states, I would say few of them work well when the the cooperation is starting from the bottom level, that is starting from the city level. And certain jurisdiction, the model works where you need pressure right from the top. So I have the example of both cities in my hand. One, that of Ranchi, that is able to navigate its way, that started from bottom up approach. They started from the city itself. We sensitized our key stakeholders, brought them on the same platform, and as Dr. Gupta sir was highlighting, we rigorously handheld the corporation authorities at each step. It's like being with them every minute, every second, pushing them that this is in the best interest of the public, and sort of working the way through upwards. Whereas if you see the example of Siliguri, we had to do a qualitative survey, and that's simply because of the political sensitivity, and like you rightly said, that we needed something from top to come. And that is why we are working through the state of Kolkata, where we are trying that, the push comes in, and they are in now verge in process, and we are hoping that in next few days we'll be seeing some concrete licenses being issued. So it has to be devised based on each jurisdiction, each authority's perspective, and that's the reason, sir, we need to have a hand-holding support, and we need to work together to see what best suits your context, your jurisdiction, sir.
Thank you so much. Very
So,
detailed
Actually,
presentation.
I agree with
Thank you,
Dr.
sir.
Nidhi.
Thank you, sir.
Punjab was a comparatively easier state to work for, but still we couldn't do it in Punjab. So I can understand that Himachal Pradesh, I think they took a very proactive step. I think that is the only state which has got its own act, if I'm not
Absolutely.
wrong.
Yes, sir.
Others,
Yes,
they
sir.
have
Absolutely.
the provision in the municipal acts. So
Yes,
I'll
sir.
request Dr. Aruna to please be brief with her comments.
Yeah, thanks a lot, Dr. Nidhi.
Yeah.
I just have one question. Do you have any standards or the guidelines set for the tobacco vendors licensing as far as the display of the products, the tobacco products are concerned?
So, ma'am, if I've understood rightly, there is no specific guideline. It's just the COTPA guideline that the same should be followed, that they should not be putting up, any poster stickers, and they should be having the warning signages. The brands should not be put up. The logos should not be put up. The name. So what I'm trying to say here is, ma'am, that we are not trying to create a new structure and burden the authorities, but we are trying to just complement or strengthen the existing structure. So for even the advertisements that are being put up, we're just trying to emphasize the ones that are already mentioned in COTPA. There should be no product display, especially within the reach of minors, where they can sort of
I
point
got your
out and
point,
show.
like the chips eye level and bi level,
Yes.
like that is
Yes, ma'am. Yes, ma'am. So basically enforcing and complementing COTPA at point of sale, but through the concept of vendor licensing, where we can regulate the vendors and make them follow or comply with this particular set of regulations. That is, once that is done, ma'am, you can always, down the line, stricten those perspectives. You can make them as stringent as required, but the basic is to comply and stand aligned with COTPA.
And any specific population density, like the shops license has been given?
Again, ma'am, to answer that is, this would be specific to specific jurisdiction and the population of that particular city. So for example, like I was talking about the global practices about Philadelphia, they had it only like one vendor per 1,000 population. For example, in Uttarakhand right now, we are trying that within a ward we should have not more than 3 to 4 vendors, and they should be placed at a requisite distance, where they are not placed together, sort of being dense in one area or just focusing in one area, but appropriately placed so that they're not easily accessible to youth especially. So it depends whether how big is the city, what is the population of the city. You can either have it even as one vendor per 10,000 population. So you can imagine, since India is very densely populated and the population across the city also varies, so it is completely up to the discretion of the authorities, what they see and how they want and how stringent they want to go about it.
Because why I'm asking is, is it proximal to the bars?
No.
This is how they are located, like usually around the bar.
It has to be around bars.
Shops, alcohol shops, and confectionery, chips, all this namkeen. So they are invariably clustered around the bars.
That's what I said, ma'am. The density they are densely put up in certain specific areas. So while we are chalking out these terms and conditions for the vendors, that should be one of the condition, that it should, for example, it should not be within 100 yards of educational institutions. Similarly, similar to that, we can introduce that these shops should not be within the vicinity or XYZ area of any bars, any religious places, any areas that are frequented by youth, such as playgrounds, parks, gardens, or amusement parks. Within Now, 100-yard can be utilized as an example, or the corporation can itself define the area or the radius that it wants the vendors to be away from that particular. So that is at the discretion of the authorities. They have that power to cull that out in the terms and conditions. So that is definitely doable. Once the authorities are on board and agreeing to implement, there are various conditions, ma'am, that can be introduced and be implemented at the point of sale.
Yeah.
Thank you.
So thank you, Dr. Arna. And she has raised a very valid point that it should be away from the bars, because smoking cigarette and consuming alcohol,
It's
that
very
goes hand.
common.
Yeah. So I'll request Dr. Shipra, if she's with us, for her very brief comments.
Hello,
Or Dr. Siddhi. Dr. Shipra is with us.
Yes, sir. Good evening, sir.
Okay, good evening. Yeah.
Dr. Nidhi, it was wonderful presentation.
Thank you, ma'am.
Actually, I just want one point to be added by you regarding the rural area, the interiors. So, most of the time they are illegally these shops and everything.
I agree, ma'am. I very much agree. And like I said, we are already in the process of considering this component, and we are working with the rural development sector in Jharkhand as well. I come back to Jharkhand very often because that is one of the pioneer cities which has actually gone this far for implementing this policy. So we are working with the rural and Panchayati Raj development as well to ensure that this concept is being introduced within the rural limits or the village level also, because even in village there are a lot of small shops that are within the homes itself. They just open the window and it's very easily. So we want to stop that concept, ma'am, and that is the reason that we are presently working. I would be happy in the coming days, once we have some concrete outcomes over there, we would be happy to share learnings from there as well for the other states to consider. Thank you, ma'am.
Thank you. Thank you.
I'll request Dr. Siddhi for his. Thank you, Dr. Shipra. So I'll request Dr. Siddhi if she has some final thoughts.
Very nice presentation, knowledgeable. Ma'am, I wanted to know about limitations and resistance from the vendors, if any, if you faced.
That's a very good point there, ma'am. I think you have hit the bullseye. I think industry is one of the most important perspectives to keep in mind, because you face a lot of pushback from the industry. We had a lot of pushback in all implementation states. So I think the way to do this is, to before or while you are introducing or working on the steps of introducing this policy, is to start working on IEC, creating awareness and garnering support from other key stakeholders like academic institutions, medical colleges, other NGOs that are working for such noble cause, self-help groups, volunteer groups. Getting support from these particular verticals is very helpful, and encouraging the corporation authorities to go ahead with the implementing this. So industry pushback is nothing new, ma'am. They always attack on the livelihood perspective. They attack on the 5.3 policy. They attack and try to squeeze tobacco from all the sides. So I think this is something that needs to be answered in a different way. Like I said, we usually, what we do is we act after the action is done. We try, once the action is taken from the industry, we try to counter that. But in few of the states that we are implementing now, is what we are doing is we're trying to first gather support. When this kind of pushback comes in, we already have requisite support, and the commitment from the authorities stay in place and does not affect the implementation. So we're trying this particular model as well, and let's see if we get some good results. I'll be happy to share them with you as well.
Because
Yes, Dr. Gupta, sir, is something to add, sir?
Yeah, we had faced this. One person got lesion and all, and we asked him to stop. Then we realized he is selling it in his own shop. We asked him to stop selling in his shop. कहते मैडम लोग ही नहीं आएंगे. So मेरा पैसा ही जाएगा इससे. So vendors also have their self motive for this. And
So in this case, ma'am, it is very important that we reach out to the union or the union leaders or the influential leaders of the vendors association. We did the similar concept in Ranchi as well. What we did was we tried to sensitize and have a consultation meeting with the vendors association. So sort of have their buy-in and have their, usually I'm not sure if you're aware about Dr. Meera Agiji. She always mentions, ma'am, that you should always have the beneficiaries included, because if they don't see it as their benefit, they will never abide by that. So that's what we did in Ranchi, and that is why you see that we have the vendors who are applying for the licenses. So it is very necessary to have reaching out to the people who are regulating or who are controlling these smaller shops people, or who are influencing them, so having them on our side, having them on the positive side is one way to sort of take this forward. Yes, Dr. Gupta, sir, you want
Yeah,
to add
Dr.
something?
ma'am, one more point. A follow-up will be done by municipal corporation or NTCP, or who is doing that if illegally it is being sold?
So it is basically, it comes in the purview of both. Obviously, right now the corporation is not authorized to sort of seize and do that. That of course comes in the district tobacco control cell's purview. But obviously, like I said, it completely depends on the corporation whether they want to take. They have the power. They can chalk that out. They can cull that out through their acts, and they can take this forward. But as of now, right now, it's only the district tobacco control cell that has been put in place to take this part forward. I'm
So
sorry, Dr. Gupta sir is
it's
wanting
okay.
to share
So Dr.
something. Yes,
Rakesh
sir.
Gupta, we'll
No, no,
have
just a
final
very
words
small.
from you.
Yeah,
And
very
after that, I think, vote of thanks from Rajiv is with us. Yeah, thank you.
very, very small point.
Yeah,
I
sure,
think
sure. You
TVL
can.
is part of end game eventually. And so, Nidhi, because you are the flag bearer for TVL, can you please add this point of end point also into TVL?
Most
Because
definitely, sir.
talk about end game as well.
My apologies, I forgot to add in, sir, but that's definitely as one of the points. I'll do that, sir. Thank you so much.
So, Dr. Sanchika, please invite Mr. Rajiv is with us for a formal vote of thanks.
Yeah, sure, sir. So I would request Mr. Rajiv Chaudhary from RCDC to please propose vote of thanks.
Rajiv, are you with us? I think we have missed him. So in any case, I'm really thankful to Dr. P.C. Gupta, sir, Dr. Rakesh Gupta, Dr. Sanchika, Dr. Nidhi, Dr. Aruna, Verma Saab. So thanks a lot. And we also had, we have with us Dr. Aruna, Dr. We should plan actually a physical workshop on TVL, and we must impress upon Ministry of Health to take the onus and do it at the center level. We have tried that in ANDS, and we have been very successful. Earlier it was from the state side, and then actually Government of India took over. So I think we can move towards that direction. So thank you all. Thanks a lot. Namaste.
Thank you all. Thank you so much.
So just 30 more seconds I would need. I
Sure.
would like to inform about the next session. It is on 25th of October, and the topic is establishment of National Resource Center on Oral Health Care, and our subject matter expert will be Dr. Arpit Gupta. So we'll see you again on 25th of October. Namaste.
Okay. Thank you.